Okay, guys. Hi, welcome back to fall. So this is going to be basically your, well, I would say 20-minute orientation video pre to doing our shadow health orientation if you come on Friday at 1:30. Just a reminder, so Friday at 1:30 will be a live actual Zoom orientation. I will send you the link by Friday morning. This week is very, 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 very busy. So make sure you get it. Don't worry. It may be that morning, but you will get it. And then our normal meetings for Shadow Health for our virtual clinical experience, we will be meeting, and thank you guys. I know it's really hard to pick one time for everybody. And I try to be as flexible as possible. Sundays just kind of seem, I know it's the weekend, but I'm teaching, I think like 6 clinicals or something. So that for me, it really helps. So thank you. I really appreciate that too. So it will be every Sunday. So this Friday, we'll have orientation at 1:30 and you have this pre-orientation or orientation because this Friday is not mandatory if you feel good about it. Because you've done Shadow Health before, don't have any questions, or if you have like a small follow-up question, of course you can text or email me. And then normally starting the following Sunday at 1 p.m. that's when we will actually start our post conferences. So this is basically, I'm going to show you a Canvas because I know you don't have access to it. It's all uploaded. The only thing that I have not done is, and we don't have to do it, but I'm going to do it because I think so struggling with it because I'm like, everything's on there. So I may or may not do it, but if I do, I will do it tomorrow. So I do have a general syllabus up, and then everything else is in Canvas when it's due, and it's pretty, it explains it pretty well. So that's why I'm thinking I may not do an actual syllabus for just Shadow Health this time. So we'll see. And maybe I'll get your opinion on it on Friday if you feel that it's a little bit, because to me, I'm more comfortable with it because I've done it. So I just want to make sure everybody feels really comfortable, and the less stress is best, right? Okay, so let's go ahead and jump in with, and I'm going to be looking over here because I have points that I want to make sure that I get out to you. So Shadow Health, for those of you who have used it and who have not, it is a virtual health experience. I personally really like it. I use two because I do teach for other schools. So I use iHuman. I actually just learned how to use that today. It's pretty cool as well. They're very, very similar. I think they're really good experiences if it is what you make of it. So keep that in mind. And the reason that I say that is because I wanted to give you guys some advice that I learned from the previous group that I had. Not that any of them did anything wrong, but I did notice some correlation between, there is a passing rate. So when you're actually in Shadow Health doing your simulation with your patients, and you'll have 5 patients because there's 5 weeks, and not to rush, basically. So that's why I kept saying I try to push our post-conference late into the week, because when we do that, you have more time. So you don't have to be, yes, it is considered a full clinical day. So remember that. This is actually giving you hours toward the NVCB, state board, whatever they're called. So we are actually being accountable to them, saying we are doing these hours. So that is important. So keep that in mind. We're not being mean by, oh my God, we're making you read all this or do all this or this and that. And oh my God, Shadow Health takes this long. And it does. It is a time consuming experience if you're actually putting in the effort and doing what it's intended to do, because it's supposed to be a clinical day. So please keep that in the back of your mind. I think that was really important. Something that I really learned as well from the summer, I think, so we did it. And then you don't have to repeat it. You must get an 80%. So it used to be 75%. You guys are now advanced. This is your last semester. You're advanced. You're not intermediate anymore. You're advanced. And you should be getting 80% or higher. And if you don't, you do have to do over. So keep that in mind. So the correlation that I saw is the time. If people, and I can see everything, just keep that in mind. I go in, and I'm not like trying to say I'm spying on you or being mean or malicious, but I can see if you failed and you got a 50% and then it's like, oh my God, Miss Amanda, I have to do it all over again. Well, yeah, you spent 20 minutes on something that was supposed to take 2 hours. Plan your time accordingly. And with us, since our post-conference and your stuff for Shadow Health is not actually due until Saturday at 10, you have all week. You don't have to do it Tuesday or Wednesday. You have like time to actually do it, which is really great. And I believe you can pause and all of that. You'll learn that in the orientation in Shadow Health. So, okay. So let me share my screen with you so we can go over dates and kind of get everything down. So actually, before I do that, number one, shadow health in general, there are two things due on Saturdays, and that would be shadow health, the patient care, and your medication sheets. And this is all in Canvas, by the way. You're going to see it all. And so you don't have to remember, I'm just kind of giving you the overview and why I did it this way. So shadow health, you do not turn in Canvas. Shadow health, it's automatically put into the database in shadow health in itself. So if you know, and it will tell you right after you're done, it'll say you got a 85%, and then you know you're good. And it actually will give you a little hint or tips and things of maybe how you could have done better and whatnot. And it does take a little bit of time to get used to the system. There is an orientation that is in shadow health as well, and I'll show you that. I definitely do it. And it teaches you how, again, this is a virtual reality. It's not perfect. And it will teach you how to talk to the patient, and it kind of helps you. It took me a little, I would say probably the first week. And then probably the second week I was like, okay, good. And the students that, at least the feedback I got as well, it took them about a week or two to get down the lingo, because again, I don't know how they do it. This is very interesting, but they actually know what you're saying. It's very, I really like it. It's like almost like a real human. They have imperfections on their skin. It's a very interesting, it's my favorite one yet. Let's just say that. And yes, I'm easy to please, and I'm happy about most things, but I think that it really is. I think this should be actually input into, even when we can go back into clinical, I think this should be half our clinical, because I think it's a very good learning experience. And a lot of the time in actual clinical, people are just standing around because we don't have anything to do, but that's just my own opinion on the side note. Okay. So on Saturdays, starting not this Saturday, but starting Saturday, September the 5th, that's when like the real first thing is due. And that is when you will have shadow health is due Saturdays at 10 p.m. And again, you do not turn that in Canvas. You will see it in Canvas, but that's only so that you know that I marked you complete before we meet on Sunday. So you know that I saw that you did it. And that's just for your own kind of anxiety and my like letting you know, like, I know you did it, you're good, all good. And then your medication sheet. So I do that a little bit different as well. So those are also due Saturday. I give you that time, Saturday at 10 p.m. they're due as well. And instead of having you pick or do all the medications, again, I'm more quality versus quantity, because I feel like if you pick 5 medications, so it's 5 and it's worth 5 points, even though it's a pass or fail class, I do assign points to most of the stuff, because I really want you to think about it and do it, because we're not there together. And I really want you to learn this, sorry, my dogs are out, you guys. And so with the medications, if you pick 5, and please try to pick 5, and I do look at this, like, I understand that sometimes the kids may not have, okay, so if they don't have 5 medications that I don't know yet, then obviously I know that's why you pick 3. I'm not going to mark you down. But if they have 5, and it can be PRN, it can be scheduled, pick 5 that aren't, don't pick Tylenol if there's 5 medications on there that I know darn well you probably haven't heard of. So really try to challenge yourself so that, sorry, Tyler has joined us now. So, so try to pick 5 medications that are actually different, maybe that you haven't heard of before, you know, so it's a learning experience. And also something, and this will come up in post-conference, I do come prepared with questions. I see the medications you pick. That's why they're all due on Saturday. So we can actually go over certain things and learn and retain information. I think I've had all of you, so you know how I'm I want you to remember what you learn. So I'd rather you remember 5 things than do work of 15 things and not like remember like 1. That's just my philosophy in teaching. So, the other thing I was going to say is also, and I did put this in Canvas, know why the patient is taking the medication. I think now we're at that stage where it's really important. We're at the higher level of critical thinking. So, you know, someone can take aspirin because they have pain. And someone can also take aspirin because they're taking it as a preventative for, which they're actually doing studies on it now, but whatever, let's just pretend we didn't know that, for blood thinning, right? So that people can potentially prevent cardiovascular issues. So you want to know why your patient's actually taking the medication they're taking. So that's something else that I'm going to incorporate in this clinical as well. Okay, so those are the 2 things that are due on Saturdays. Shadow Health, and the medication sheets. And that starts on September 5th, and they are due at 10 p.m. Shadow Health, you don't turn in, it's automatic. Medication sheets, you do turn in, and we'll look at that on Canvas. Sorry, I've been up since 4 and online. This is, I think, my 7th meeting. So, well, I'm talking to myself, but yeah, 7th meeting. So I'm doing the best I can. Okay, then the second thing is we have a weekly journal. So the journals that you would normally do in clinical, you will still be doing. They're a little bit different. They're more towards pediatric. And also a side note is that we do have autonomy as far as like what we as instructors want to provide and teach. What I do want you to keep in mind is that as a staff, for those of us teaching clinical, it was kind of a coming together of what we're all going to do. So it is 90% to 93%. Maybe I'm kind of more toward the 90% because I love my own autonomy. And of course, Carol, because she is the pediatric expert. So it wasn't all choice of exactly what to do. Not saying there's no real reason I'm saying that, but it's so that everyone kind of gets that same experience and the same expectations, rather than, oh, Miss Amanda's class is only doing this, but this person, oh my God, they have to do all this. So we're trying to make it as similar as possible. So I wanted to make sure that everyone was aware of that. Okay, so on Sundays, the weekly journal is due at 10 p.m. because I don't need your weekly journal before we do our post-conference, right? Because our post-conference is at 1. So, and then our post-conference is at 1 on Sundays. And then we have articles actually that are, that Carol found, that she found. I'm so sorry, you guys. It's National Dog Day. I feel so bad locking them up. So I'm trying to be nice, and now they're ruining it and going to get in trouble. So there are a lot of articles, and you'll notice, and they're pretty long, and I felt bad. I was going to only do half. I posted them all. There's only one that I couldn't open that I didn't put. So keep this in mind. I want you to read the articles, and something will be brought up during post-conference to kind of, because we have to evaluate that you did read, look at the articles, and as far as remember, because this is time, we need to be honest to the state and for you to graduate. I mean, that's something that's ethical and moral. So what I did when I was today, for example, I wanted to get kind of an idea of how long it would take. And I mean, some of these articles are 15 pages long. I mean, I don't expect you to look at it and memorize it, but take a good glance at it. And I mean, get a good idea of what it's talking about. So that is what I will say. I don't expect you to read it, memorize it. Some of them, 1 week, I think there's 4 journals. It's a lot of reading. So, just to each their own, however you retain information, that's what I'm expecting. Okay, I put my troubled son away. Okay, so we moved on now from the articles. Okay, so we pretty much know now a little bit of an outlining of what's due. So let's go ahead and share the screen and start with Shadow Health. Right here, perfect. So Miss Marcia had sent everybody a code so that they're able to sign up for Shadow Health, and make sure you do that in order to be able to participate. So clinical technically starts Tuesday, so please make sure that you register and get everything done by Tuesday. And once you sign in, you'll of course go to advanced pediatrics. Your guys might look a little bit different, but you will get there. And once you get to the assignment, so you will notice, so there are 5 weeks of the of our clinical time together, but there are 7 things due. So some people might be like, oh, what does that mean? So the first one actually is 2 things. So there's an orientation, and for those of you who have done this before, I do recommend you doing the orientation. I'm actually going to redo my orientation as well, just to kind of, it's been a while, right? I mean, it doesn't take that long, and it helps you be able to kind of experience things. It's open as of now, so you can actually, if you register, you can do it right now. And I think it's really important, again, because so you can either talk into the microphone to the patient if you want to get that feeling of talking to a person and they actually answer you back. They kind of sometimes have even an attitude. It's really interesting. Or you can type it, whatever you're comfortable with. And remember, it is a computer, so sometimes they won't understand what you're asking, and the computer will actually prompt you. You can ask for help, and you'll get this through the orientation. So the orientation is open now, and then the concept lab. So these two things, for example, it will tell you when things are due and all of that over here. And I will tell you just right now that the first two things are due on, for me, on the shout out is due on Sundays at 10 p.m. So you have the time to do that, and then everything is here. So this is week 1, and then we have week 2, 3, 4, and oh, what happened here? Oh, I see what she did. So the orientation is just on itself, and then we have 1, 2, 3, 4, 5. What is happening here, Miss Carol? What did you do? Oh, I see. So Tina Jones, yes, she's always the one that we do the orientation with. And then these are your patients. So you have, oh, another thing, just in case your classmates say it. So we're supposed to do a concept map every week. I took that out. I just feel like it's too much. If you really want to do one, you can. It just seemed like a lot with all the articles, this, that. It was just like, it seemed like a lot. So I just took it out. Just in case someone does say, oh, but that was something that we were kind of supposed to do. Not supposed to, like we have to, but it just felt like it was pretty, a lot. So I took it out. All right, so we have week 1, and then it tells you, if you click on it, it'll actually tell you when things are due, when it opens. So we don't want you to go ahead. So we don't have these open until certain dates so that you can't go ahead. The orientation, of course, is already open. That was open on the 23rd, and we keep it open the whole time. So if you ever want to go back in and kind of play with it, you are allowed to, and that you can. And then we have the concept lab. And the cool thing about this is once you actually open it and do it, it tells you what to do. You have a preceptor, forget her name, but she tells you what to do, and it's really cool. You don't feel as lost as I think some people feel they're going to feel. At least how I felt. I'm like, oh my God, this is going to be a nightmare, and it really wasn't. I felt it was really well explained. So it tells you how long it should take you, 40 minutes. That it opens on August 23rd, and that it's due. Oh, Carol. Okay, well, it's not supposed to be, it's not due September 14th. So I'm going to talk to her about the opening dates and close dates. This was different the other day when I looked at it. My bad. I did not set these. But the point of all of this is to tell you that this is pretty well done as far as it will tell you when things are open, when they're due, and you will know when things are due because of the Canvas. So let's just try one more because this is usually very, yeah, so perfect. Like right here, it says, okay, this is due or opens on September 1st, and then it will be open until September 7th. However, for us, our stuff is due on Shadow Health. I have my autonomy, so I made it due on the 6th at 10 p.m. Even though it's open till then, you go by my due dates. I hope that makes sense. And again, that's why we're here on Friday. So this is pretty much Shadow Health in general. So doing the orientation is very helpful. It will help you be able to know how to use Shadow Health, how to talk to your patient, kind of how to move things around. You can look at documentation. Again, pick your 5 medications, and you will use your medication sheets that we use in clinical. I'll go over that when we're in Canvas. So this is pretty much what it is. It tells you when it's due, how to do it, whatever. Or sorry, not when it's due, when it's open, and when it closes. When it's due is on Canvas because that's per myself. Okay, so this is Shadow Health. It's fun. Let me know if you have any questions about it. I would highly recommend after I send this out, if you have kind of like you haven't done this before, and I think there's at least, I think 2 people in our class that have not, that you test it out so that I can help you on Friday, please. Okay, so now we're going to close Shadow Health. All right. Now we are going to share the screen and go with Canvas. And that will be the last thing that we do. And I think that will make much more sense to go over kind of like the due date syllabus and what things should look like. So, okay, so let's look at Canvas. I think this is probably my favorite one to show because you don't get to see it and it helps us kind of get through things. Okay. Okay. Why aren't you opening Canvas? Sorry, guys. It says I'm sharing, so I'm assuming you can see this. Okay, so I was a little extra this semester. I'm like, I'm gonna put my name on it and change the color, so I just did. So this is us. When you can see it, it will actually say Miss Amanda's shadow. So you'll know that Shadow Health Advanced Clinical. Once you click on it, it has the announcement that I sent yesterday, which is kind of a little preliminary information. I have everything already in here. So let me just quickly show you. When you click on assignments, it's very organized from your journals that you will turn in each week. And remember, as I had said, the journals are pretty much what you would normally do in clinical. So you have the choice of, you can copy and paste this, you can actually type within this. However you want to turn it in, I made it available in the background where you guys can't see, that you can turn it in however you want. So if you're, and I did put the critical elements down here for number 1, and I do understand that it is going to be a little more limited, obviously, because you're not in clinical. Do the best you can. Okay, I'm not, I do understand that this is different. Please do put some time. I do, again, I don't know why, maybe because I'm a psych person at heart. The journal is important to me, and I want to know what you think. And you will notice I did change. So 2 things I changed on the journal is I put 2 things instead of 3 on number 7. And then, because I want to make it worth the exact amount of points it would be. And so number 1 is worth 2 points because it's 2 critical elements, and then that. And then the last one, you must put something. No NA. I want to hear something. I don't care if it's, I really enjoy this clinical because I learned this, or I'm not really enjoying Shadow Health because of this. Whatever it is, you must say something. That's important to me as well. Okay, so that is what the journal looks like. And again, you can answer it within the journal, or you can cut and paste this into a Word document and then download it into a file. However you want to do it, I don't care. Even if you text it to me and say something's not working, I don't care. As long as I get it by Sundays at 10 p.m., we're good. All right. So that's that. And then every week is the same thing. So every single Sunday at 10 p.m. And it's worth 10 points because it's worth 10 points if you add it up. All right. Then we have the reading articles and whatnot. So for example, if you type on week 3, you should read these before we meet. So it's due, for example, on September 20th at 1 p.m. The reason I'm saying that is because that's Sunday. The 20th is on a Sunday. And 1 p.m. is when we meet. So you should have read that journal or these journals in order to potentially be prepared for a conversation. And again, I'm not saying if some of these are pretty long, you don't have to know, you don't need to be an expert at asthma or diabetes or RSV, but I want you to look at it and have an idea. And it just adds additional information, and actually really good information. And again, this was from Miss Carol, of course, because this is her passion. And this is our pediatric rotation, and this is stuff that we're not actually going to get to see. And in all honesty, and I'm not usually Debbie Downer, this is one of the clinical rotations you usually get to do the most in as far as skills, and we don't get to do that. But you know what? We're going to make the most of it, and that's why I'm trying. We added a little bit more this time, such as the articles and whatnot. So please take advantage of your own learning and really, this is going to help you with your boards. I do promise you on that. So please have these at least, I don't want to say browse, and I don't want to say completely read, but just have a good understanding what the articles are about, because we will have a conversation. And I do keep track who's participating during post-conference. That is important. And if I notice that you're not participating, we will, I'm not going to call you out usually, unless it's funny or a good opportunity, or you're falling asleep. I'm not talking to anyone in particular, but I want you to, I don't feel like I'm asking too much of you from Zoom wise. So I feel like when we're on Zoom, we should be making the most of it. And that's really important because yes, I'm nice. Yes, all of that. However, and the way the world is happening right now is just so scary and there's a lot going on. However, we need to set some standards to make sure that you're getting what you deserve too, right? So, okay, the next one will be the medication sheets. Again, these medication sheets are your own medication sheets that we would normally use in clinical. If you don't have any, get them from your friend. Please don't email me. I'm overwhelmed. Even if you don't have it, but you know what's supposed to be on it, I don't care if you put it on a piece of paper, give me the medication, the contraindications, all that good stuff. And remember, you only have to do 5, but you better know those 5. And I'm not saying if you've had me before, you don't need to know every single little tiny thing. But if you have a patient who is on a medication such as metformin, okay, they're on metformin 500 milligrams. Why are they on metformin? They're on metformin because they are pre-diabetic. Okay, why? What does metformin do? It helps to lower the blood sugar, whatever. I don't need you to be the encyclopedia and the expert at metformin, but you should have a general idea of what the medication is, why they're on it, like the most pertinent side effects. So of something, we don't tell our patients 25 side effects. We say the most common ones so that they are aware and they remember, right? So please make sure that you do that because this is something that we will, I love medications. We're going to talk about medications at post-conference. Again, I come with a agenda and then open it up to the room. So if we open up one of these and it's worth 5 points because I asked for 5 medications. So we'll be looking at it. So you can click, upload it, however you get it into this realm or whatever, or if you are not computer savvy or having trouble, again, just text it to me. I'm very flexible. I just want to see that you did it and I can see it and I can use it because I will use that medication for our post-conference. All right. And then last but not least is shadow health. So again, you do not turn anything in. You can essentially ignore this completely. So these are due on the Saturdays at 10 p.m. before we meet, of course, the day before. So I have time to look at it, say that you completed it. And this is just for me to mark that you completed it or you did not complete it. Remember, this is a pass, no pass class. You must complete all of your clinicals in order to pass. So you have to have all of those points. So if you do miss a day, we'll somehow have to make it up. And we do not accept late work. That is something that was done by the, I don't know what we are, committee of nurses or whoever we are in the faculty, that we decided that over the summer, we do not accept late work. I mean, obviously, unless there's something, so let it talk to me. Okay. Hasn't happened yet, but no late work. We are doing 80% now or higher. Last time it was 75. I know in the program at 75, now it's 80. I just do what I'm told. It's 80%. If you don't reach that, you have to get it until you get it. And pretty much everything that you need to know as far as due dates. And I think all of this makes sense to everybody. And if not, of course, I'm going to be here Friday and we can go over it again. I think more of the questions will be on shadow health. That's what I'm thinking. And that's completely fine, or whatever you need. The only other thing I really want to go over and then we're done is this is the general syllabus that we have to do by mission law, I guess, mission college law. And I don't know if I'm going to do one for shadow health like I did last time, because I feel like I did a better job on kind of organizing things so that people understand it. I don't feel like why quality over quantity, or no, whatever. I'm reaching my point of the day, I think, here. So I did get a new cell phone number, so please keep note of that in your phone. If you need me to text, we all know is best. Obviously, we've been texting, so you have my number. We have 5 patients throughout the semester. Miss Marcia already sent out the link so that you can get into shadow health. And remember, we do have it open at a certain time so that you don't go ahead, because we're trying to make this as close to an actual clinical experience as possible. We'll be meeting this Friday at 1:30 for the in-person orientation if you need it. Again, it's not mandatory. But I'm also going to ask, please, if you don't come to that, to please not if you have 1 or 2 questions, that's fine, but don't text me like 18 things. If you come if you need to, unless you're not available, of course, and then I completely understand. You all have my email because of this. My personal email did change. I didn't actually put that on here, but you have my email, and text honestly is best, just to be honest. I get that immediately. My phone is always with me. And most of this is just the normal stuff. I did put in here that I didn't put as the specific as I normally do, because I'm going to put that on the syllabus for Shadow Health directly. But again, I feel like, I mean, we know we have weekly journals, the medication forms, the articles, Shadow Health patient care, which is what you actually do in Shadow Health. And remember, I can see what you actually do, what you say, everything. So just, I'm only saying that because I tried to be funny with Shadow Health. And I think I like asked the patient out or something. It was hysterical. I don't remember what they said. So just keep that in mind if you're trying to be like, it's kind of like with Surrey on your phone. Like, I can see what you're saying. I just feel that that's like a nice disclosure to say, because of course I had to test it out and be like, hey, do you want to go on a date? And they said no. But anyway, just keep in mind, I can see what you're saying, what you're doing, how long you've been on there, all of that. And I feel like a lot of this is really self-explanatory, other than Shadow Health and maybe becoming comfortable with it. So I think I'm not going to do the Shadow Health syllabus, and I'll just answer questions, because right now time is time. And I'm not really sure why it did this. Just as a side note, just focus on the assignments. I don't know why it put all the assignments over here too. It's kind of weird. So only look at this if you want to look at the syllabus, which I don't think you need to look at the syllabus. You know what a syllabus looks like. You've done this 100 times. Just focus on assignments. Do your assignments. Do Shadow Health. Come to post-conference. Come Friday if you need me. Let me know what you need. And I think we're good, really, from there. And I hope I covered, let me just check my checklist. For the most part, I think I covered everything that was like the most important, such as you don't have to turn in stuff for Shadow Health, because I can already see that. The importance of the journals, the points, how long post-conference normally is, how to come prepared. Normally we talk about medication. I'm not one to put someone on the spot unless I predetermine you for something. If you said something maybe really cool in your journal or whatever, like I might text you and ask, hey, do you mind explaining this today or whatever. I think that's it, you guys. I mean, I can't really think of anything else to say. That's it. I'll send this out, and I will see you guys on Friday at 1:30 if you need to come, and if not, I'll still be here. And oh, okay. Hi, Violet. Say goodbye. Hi. So I will see some of you then, and the others of you on the 6th at 1 p.m. I look forward to it, and I miss you guys a lot. So I really look forward to seeing you during this time, especially. Okay, we will see you later. Thank you.